Vaping and e-cigarette is not good for our lungs and our brain. Let's get a few things straight. There is some chemicals inside the vaping and the e-cigarette. We call it diacetyl. We call it formaldehyde. They inflame, they irritate, they cause our lungs to look like popcorn lungs. It's very important to pay attention to this, okay? There is some metals inside that vaping and that e-cigarette, like nickel, like lead, like chromium, like tin. These are not good for our lungs. Nicotine that comes with that vaping and the e-cigarette, it causes vasoconstriction, causes hypertension. Unnecessarily, it could give you heart attack, stroke, peripheral artery disease. Okay. If you keep smoking that vaping and then that e-cigarette, you are at high risk for these things I just mentioned. When we go to the parties, when we're sitting around our family members who vape and smoke, we are also secondhand receivers. So we are not excluded from that. We are also at risk the same way they are also at risk. It's very important. Now let's jump onto the brain part. As human beings, on our brain, there is something called prefrontal cortex. Prefrontal cortex, it fully develops when you are 25 years and above. So how about our little cousins, our little brothers, our little sisters who are vaping at the age of 18, 17, 16, 19? Theirs haven't fully developed at the age of 22, 23. It takes 25 and above to fully develop. Prefrontal cortex help you with your judgment call. It help you with your great decision making. That smoking, vaping, or that e-cigarette thing is unnecessarily going to cause them mood disorders, behavioral changes. It's very important. They develop something called nicotine receptors in the brain. We also, above 25 and above, smoking and vaping that thing, that e-cigarette will also cause us nicotine receptors in our brain. So then we have to vape higher doses. We have to e-cigarette the thing higher doses before we can get the same satisfaction like we started 6 months or 1 year ago. The little ones, their behavior is also going to be detrimentally affected, their mental health. Okay. They have disorders where they have withdrawal disorders when they haven't vaped. Okay. We have to pay attention. This is our body. The little ones, they are still getting older. We can inform them that they have something called prefrontal cortex. It hasn't fully developed yet. So whilst they are smoking and vaping it, they are already causing a damage to their prefrontal cortex. Pay attention to that. This is your body. You choose what you want to do with your body. But from our lungs to our brain to even if we don't do it, we are still secondhand receivers. Your surroundings, your party you're going to, the best friend visiting you, your cousin, your brother. It's very important you advise them as well. My name is Nurse Solomon, and I'll see you.